Summer's coming to a close, and the next thing on our horizon is open enrollment. This week, we're going to talk about Medicare and some of the updates that are coming. This week, we have our friend Kelly Blythe with us. 509 Insurance. She is an independent insurance agent, and we utilize her a lot for Medicare. Some of you recognize her because you've sat down with her in the past, and for those who she is a new face, this week we're going to talk about some of the things that are coming up in terms of open enrollment and Medicare updates that we really think everyone who's either going to be going on to Medicare shortly or who's currently in a Medicare plan should think about. So Kelly, welcome.
Thank you.
I know this is your first time doing a video with us. So
yes.
So obviously everybody this time of the year starts looking toward open enrollment. Is there any changes coming to Medicare? And I know there's some ones coming this year that maybe haven't been seen in the past. So first off, tell us a little bit about yourself and what should anyone watching be looking for?
Perfect. My name's Kelly Blythe. I'm an independent licensed agent, and what that means is I represent multiple different insurance carriers and plans. Today I want to talk a little bit about the annual enrollment period for Medicare, which is October 15th, and it runs through December 7th. So there's going to be some significant changes, as you mentioned. The Inflation Reduction Act of 2022 will bring about some new updates to Medicare, specifically related to the Part D part of Medicare.
Kelly, what is Part D for those that maybe have forgotten or haven't paid attention? And what are some of the updates that you're going to be talking with your clients about?
Important question. So Part D of Medicare is the prescription drug piece of Medicare. I remember it as D for drugs, for lack of a better word. So the changes that we're going to see for 2025 will include the first time ever Medicare will have the opportunity to negotiate drug prices with the drug manufacturers. Currently, CMS, the Center for Medicare and Medicaid, have identified 10 prescriptions, which are typically high utilization. They don't usually have a generic version, and they cost the program a significant amount. They're going to begin talking with drug manufacturers to bring those prices down, and this process will continue into 2028. The second most important change will be, for the first time ever, Medicare is requiring insurance companies to offer an installment payment plan option. So this will allow Medicare beneficiaries to take the cost of their prescriptions per month, co-pays, deductibles, and now they'll be able to spread those costs over the course of a year. And each insurance company is going to have to offer this to every beneficiary. So I think the last and most significant change, which will impact what our plans look like for 2025, is the max out of pocket goes from $8,000, which it's been now, to $2,000. So that's a pretty significant win. Yep. In the past, we used to call it the catastrophic phase. The coverage gap, the donut hole, so that goes away.
It's eliminated.
It is. It is. So that's a pretty big win. So these are some significant changes, as I mentioned, and what we can expect is carriers are going to have to compensate or will be required to have increased cost sharing built in. So they will have impacts on our plans moving into 2025.
So what I'm hearing is, obviously, clients should be evaluating Medicare options every year, but this year specifically, because of the changes of Part D, this is certainly a time frame when someone should be looking at their coverage options, and even if you haven't done it in the past, maybe sitting down with someone that really knows the different plan options to make sure it's fitting their coverage.
Yes, very good point. So some would say this is the most change Medicare's seen since 2005. So a tip to really pay attention to is your annual notice of change. The annual notice of change will be mailed out anytime within the last part of September, the 1st of October. And what that will look like is it's going to outline the current coverages you have and any changes. It's going to also explain if the plan's going to be there next year. So it's really important, if you haven't in the past, pay attention to those notices, and please don't sit the annual review out. This is definitely the year to do that.
For For those of you who have met with Kelly in the past, this may be a great opportunity to reach out if she hasn't reached out to you already. This is also one of those time frames too where if you've thought about reevaluating your Medicare options, or if Medicare is going to be new to you, we're going to set up times for Kelly to not only be in the office here, but any of you can reach out to your advisor and we can make that introduction or start that conversation going so that we can make sure that Part D is addressed in the appropriate way for you. Kelly, really enjoyed working alongside you the last 2 years, and I know I've heard a lot of great feedback from those of you who are clients who have worked with Kelly. As I said, she will be in office probably multiple times through the month of October so that we can set appointments as needed if you want to sit down and evaluate those options. And for any of you that want to reach out to your advisor here and maybe get more information, we'd be happy to help. Thanks for being here, Kelly, and have a wonderful weekend, everyone.